An estimated 700,000 Americans live with the most common inherited heart condition, and an estimated 85% of them don't even know they have it. Here to give us insight on the hidden disease are Lisa Sahlberg, founder and CEO of the Hypertrophic Cardiomyopathy Association, along with board-certified cardiologist. We have Dr. Matthew Martinez. Welcome to the both of you.
Thanks for having us.
Thanks for having us.
Yeah, so Dr. Martinez, can you explain what HCM is and its symptoms?
Hypertrophic cardiomyopathy, or HCM for short, is when the heart muscle becomes thickened and stiffened, making it difficult to pump blood throughout the body. It is the most common genetic heart disease worldwide, affecting both men and women and all ethnicities, and it can present with no symptoms at all. Maybe you just have a family history of hypertrophic cardiomyopathy, or you may have symptoms that are fairly common: chest pressure, breathlessness, dizziness, heart racing, or exercise intolerance that you might be saying, boy, I'm sure getting older, or I'm just not in the shape I used to be in. But those are symptoms you want to talk with your healthcare provider about, because they may actually be related to hypertrophic cardiomyopathy.
Dr. Martinez, it sounds like it's impacting a large range of people. Can you estimate how many people may have this condition and may be unaware they have it?
So it's worldwide. It's over 120 countries worldwide. And we know that even with or without symptoms, we're missing this about 85 to 90% of the time throughout the world. So it's an opportunity to think about this with your healthcare provider. We sometimes refer to this as the great masquerader, or a disease that may be hiding in plain sight, because those common symptoms that we mentioned, they overlap with lung disease like asthma or anxiety, or heart artery blockages like heart artery disease, causing similar symptoms, making it difficult to make the diagnosis, sometimes delaying the diagnosis or missing the diagnosis altogether. So making the diagnosis is key, because if we can identify the disease, we have treatment options for hypertrophic cardiomyopathy.
I really wanting to make sure we can pinpoint this medical condition for those that do have it. And Lisa, I wanted to bring you into the conversation. Can you tell us about your journey with HCM and how the disease has impacted your life and that of your family?
Thanks for talking about HCM today. HCM has been in my family for over 100 years. I've lost multiple family members, 6 actually, to either sudden cardiac arrest, heart failure, or stroke-related deaths. Members of my family experienced atrial fibrillation and other symptoms related to HCM and other aspects of how their heart was affected. I was diagnosed after a murmur was detected in a school physical when I was 12, which was a long time ago now. And I went on for years doing pretty well, but unfortunately at 21 I had a stroke, and I've had 5 implantable defibrillators over my life. And 6 years ago this month, I actually had a heart transplant, and I no longer have HCM myself, but my children do, and my community is affected by it greatly. And that's why I started a nonprofit organization to help raise awareness about HCM and provide support, advocacy, and education to families and the medical community about HCM. You can learn about us at forhcm.org, or you can learn about HCM at coulditbehcm.com. And the HCMA is really excited to be partnering with Bristol Myers Squibb to bring attention to HCM and to make sure people are focusing on the disease during Heart Month. And February 22nd will be HCM Awareness Day, and we'll be having programming at our site where you can log in and learn a lot more about HCM and learn about some of our legislative initiatives and access to care issues.
Yeah, Lisa, this has impacted you and your family substantially. What is your advice for anyone recently diagnosed or living with HCM?
So whether you're new to HCM or you've been around a while, it's a hard disease to live with. It's a chronic heart disease that impacts your physical and mental health. So the HCMA is here to provide support for you and your family. It's actually a good time to have HCM. There's lots of treatments available now. And in fact, in your area, we have 2 of our centers of excellence. We have 48 worldwide, and we have one in San Francisco and one down in Palo Alto at Stanford and UCSF. So you've got great care in your region, and we encourage patients to go seek out that specialty care. And don't panic, we've got your back here at the HCMA.
Oh, I like to hear it. Lisa and Dr. Martinez, thank you so much for joining us this morning. And to find out more, you can go to coulditbehcm.com.